I'm Dr. Patrice Harris, Director of Fulton County Health Services. On this episode of Healthline, we'll discuss the county's PITCH initiative, which is being used to help combat chronic diseases in this county. Today, we will talk to our staff and our community partners who are working with the Health and Wellness Department to apply the funds that we receive from the CDC to our initiative. Healthline begins now. Welcome, everyone. In the fall of 2014, the Centers for Disease Control and Prevention awarded the county $2.9 million per year for up to 3 years to address chronic disease. As part of their Partnerships to Improve Community Health initiative, PITCH for short, the dollars are to be used in partnership with community coalitions to develop programs, again, to address chronic disease in the county. These programs promote physical activity and a tobacco-free lifestyle. Joining me to talk about this is Lisa Gooden, who is the PITCH Health Program Administrator, and also a couple of our community partners. Nisha Botchway joins us. She is Associate Professor of City and Regional Planning at Georgia Tech and co-director of the Neighborhood Quality of Life and Health Project. And finally, Dr. Zenobia Day, who is the board chairperson of the Health Promotion Action Coalition. Welcome to Healthline. First of all, Lisa, describe the processes that led to the county receiving this award.
Sure, Dr. Harris. So CDC invited health organizations, the county, local county health departments, hospitals, large entities like the YMCA to apply for this grant funding to address chronic disease. And therefore we submitted a successful bid, as you know, and are addressing tobacco, physical activity, and nutrition within this program. We are part of a network of 39 other grantees across the country, and we are one of 2 PITCH awardees here in Georgia.
And as you are aware, during this application process, we really had to demonstrate some data about where we are right now in the county. And so talk to us a little bit about what we know about our health status and some of this data.
Sure. And so we know that, first of all, the good news is that the county ranks 20 among 156 counties in Georgia. So we're not all bad, but there's work to be done.
Absolutely.
At least we're not the worst county as it relates to health and health outcomes. However, we have a lot of work to do around chronic disease because we do rank the highest among chronic disease. In terms of obesity rates, we are at 68% of persons who are overweight and or obese. We rank higher in hypertension, cholesterol, and diabetes.
And you know, that's an issue, or those are issues that we have been looking at in the county for some time now in terms of health disparities. So I think you're well aware of that history. So tell us about the importance of and how we are working with our community partners. Again, this county has a strong record of engaging and involving community partners, but tell us about the partners specific to this cooperative agreement.
Sure, and so we've kind of put our partners into 2 categories. One being the technical partners who are helping us to implement the work, and the other being working with our community partners who are really engaging in community mobilization and community outreach across the county. So some of those partners would include Georgia State University, who is helping us implement the tobacco smoke-free work across the municipalities. And then we have Atlanta Regional Commission as a partner to help us to address physical activity and nutrition in schools, and with an initiative that we're calling Complete Streets as well. We have a great partner in Georgia Institute of Technology who is helping us to create and launch a health data dashboard that we will be utilizing across the municipalities. And Morehouse School of Medicine is also one of our technical partners providing evaluation across the entire grant. In terms of our community partnerships, we have a really good relationship with the Health Promotion Action Coalition, which is made up of a multi-sector coalition that is working to implement this work across Fulton County.
Fantastic. And before I get to Dr. Botchway, tell us a little bit about any training and the implementation thus far.
Sure, absolutely. So this year we've been engaged in providing policy training to our local community leaders, to stakeholders, to all of those who will be engaged in helping us to implement this work across the county. We also have been providing training for our school staff in Fulton County and the city of Atlanta around the increase of physical activity.
Thank you.
Okay.
Okay, Dr. Botchway, we are so excited to have you on as a partner. So tell us a little bit about what you're doing and how you're working with us on this pitch initiative.
Thank you, Dr. Harris. It's great to be here, and Georgia Tech is very excited to be able to partner with Fulton County on this exciting project, the Pitch Project. So Georgia Tech is developing a data dashboard, as Lisa mentioned earlier, that will provide free and open access to data that residents, community partners, district commissioners, city councilors, grandmas, grandpas can use to really understand the health of their community and how investment decisions in things like schools or sidewalks, parks, and tobacco-free places impact their health outcomes.
Tell us a little bit about environment. You know, we hear it a lot and people worry a lot about the environment. Tell us how our environment affects our health.
Our environment is the biggest predictor of our health outcome, and let me tell you why. And so when we think about neighborhoods have a certain set of elements in them that present options to each of us. Options to choose healthy items or healthy behaviors, and options to choose unhealthy behaviors. And over time, if we choose the unhealthy, we realize negative health outcomes. If we choose the healthy, we realize positive health outcomes. So let me ground this a little bit. So if I live in a neighborhood that has poor access to healthy, affordable food, so I don't have a supermarket or I don't have access to a farmer's market, I may only have the choice to shop at a convenience store or a fast food restaurant that over time would lead to increased weight, diabetes perhaps, and a number of other health outcomes because of that poor food environment. On the other hand, I may live in an environment that has really great access to parks and trails and green space and public transportation, so I can be more physically active. I can take my kids bike riding in the evening after school. I can do those things that allow us to be physically active so I don't have the negative health outcomes. So I have positive mental health, good weight, good blood pressure, and live a longer life. And so those are things that I think we'll be able to highlight as we develop the dashboard together so people can really begin to see the relationship between their environment and their health outcomes.
And Dr. Day, tell us a little bit about the Health Promotion Action Coalition.
Thank you.
And how you are partnering with us in this initiative.
Absolutely. So thank you, Dr. Harris, and we're very excited to be here and a part of this initiative. HPAC, Health Promotion Action Coalition, was established in 2011, and it is the platform organization that came together for diverse coalitions that are already working within communities, that are the voice for communities, but to come together and work under one umbrella, under one common goal. And so that common goal for HPAC is dedicated to improving the health and wellness of communities through several areas, through policy, through systems, and environmental change. And so with that, the mission of HPAC is to help to improve the health of the Fulton County citizens, those who live in Fulton County, those who work in Fulton County, those families within the county, and to really help to increase their health outcomes.
And Dr. Day, we have just a minute left, but I know this coalition well, and you guys have done great things for engaging the community. Just briefly tell us how you all engage the community.
Absolutely. So I must mention the coalitions that are on the ground working. We have several coalitions. These coalitions include the Asthma Coalition. They include the Smoke Free Coalition, Diabetes Coalition. We also have the Healthy Heart Coalition and Interfaith Coalition. And so these coalitions and community members have the opportunity to be trained, as Ms. Gooden talked about. So they're being trained in coalition building. They're being trained in policy systems as well to help to empower the communities. They're also being involved in many of the smoke-free and healthy activity policies and initiatives that are being engaged through this grant, as well as working directly with other community leaders, community-based organizations, interfaith organizations, academic institutions to help to engage and create policies and to support policies and activities that benefit communities. And I can say this, that I have seen many of those health disparities personally from a medical perspective. As Ms. Gooden talked about. She talked about many of those challenges and statistics. And so when we think about diabetes and think about high blood pressure, these things are very real in our communities. But not only do I see it from that perspective, but also from the community perspective. I am from Atlanta, Georgia. I was born at Grady Hospital, and so you have people who are here who work with HPAC who really engage. So this is a true opportunity to engage community, and it really is a call to the community.
Well, Dr. Day, I've known you for some time now, and I certainly appreciate your passion, as well as your passion, Dr. Botchway and Ms. Gooden. So I will tell you that the county is very fortunate to have you all on board working at this initiative. So we will take a short break, and when we come back, we will talk to more community partners to discuss the other goals and initiatives of the PITCH program. Stay with us. Welcome back to Healthline, everyone. Today, we're discussing the county's PITCH initiative. This initiative really promotes a healthier Fulton County. Specifically, we are addressing physical activity and a tobacco-free lifestyle. Joining me now to continue the conversation is Katie Parambetti from the Atlanta Regional Commission. Also, Dr. Terry Pachacek from the Georgia State University School of Public Health. Welcome to Healthline. First, Doctor, let's start with one of the major contributors of disease and disability in our country, and that's tobacco, and also exposure to secondhand smoke. Tell us a little bit about why this is an issue.
Well, first of all, smoking by itself kills about 500,000 Americans each year. But secondhand smoke, people don't realize how dangerous it is. And what is really bad is that Georgia, like more than half the other states in this country, does not have comprehensive protection. That means that people are being exposed to something that is putting them at risk.
And tell us how Georgia State and your partnership with us in this PITCH initiative will address or work on that particular issue.
Well, first thing we'll do is work with you to measure some knowledge and attitudes across the county so we know what people know, what they don't know, and what they think about smoke-free policies. Many people have been around the country and have experienced comprehensive smoke-free policies when they visit other parts of the country. Secondly, we're going to help measure how much exposure is actually happening in restaurants and bars around the county. People don't realize that even though you don't smell the smoke, you're being exposed to it. And third, we're going to be working to enable the community to take some positions, some actions, some coalitions to discuss these issues and maybe change things.
And you raise a good point regarding the community discussing these issues, because that's at the crux and the heart of where we need to start. Would you agree with that?
Well, one of the things that we know from over 20 years of experience, starting primarily in the West Coast and California, is that smoke-free policies come from the people. People ask for them, people enforce them. We pass laws to kind of legitimize what is really the public's attitude about this. One of the things we already know is that most people here in Georgia actually want to have smoke-free environments. One of the things that people don't realize, though, is that the 206 law, the Georgia law, when we did recent studies, it's been backsliding. More children are being exposed in restaurants, more people, non-smokers, and people with vulnerabilities like risk of heart attack, risk of lung disease are being exposed to secondhand smoke. Why is this a problem? Because even 30 minutes of exposure, brief exposure to tobacco smoke, can more than double the risk of a person's having an acute heart attack, ending up in the ER and maybe dying. And certainly kids with risk of asthma or other types of respiratory kind of vulnerabilities are being exposed to something that is a completely preventable form of exposure and disease and death.
Thank you. Very, very, very good points. So, Katie, tell us about what ARC is doing in this partnership. And I believe you all are focusing on the physical activity aspect of this initiative.
Yes, ARC is focused on physical activity and increasing opportunities for physical activity across Fulton County. As many people are aware, obesity is a growing epidemic, and increased physical activity can help reduce the risk of obesity, as well as chronic disease and a multitude of other benefits. So we're working with 3 different initiatives. Our first initiative is focused with Fulton County schools. Studies show that only 1 in 3 kids are actually physically active every day, whereas the recommendation is for kids to be physically active 60 minutes every day. So that's a serious problem. So we've partnered with Fulton County schools as well as Georgia Health Policy Center to increase the number of minutes that kids get activity during the school day through a variety of resources, as well as ongoing professional development with those schools to hopefully address that issue. Our second 2 initiatives are focused on increasing active lifestyles across Fulton County, and really with a focus on active transportation. So active transportation helps adults and children, really everyone, get more physical activity every day. And similar to children, across the U.S., only 1 in 3 adults gets the recommended amount of physical activity each week. So our first initiative around active transportation is promoting and educating the upcoming Atlanta Bike Share. So for those that don't know, Atlanta Bike Share is kind of like a Redbox, but for bikes. So most people have used Redbox. You check out a movie at whatever Redbox, use it for a short period of time, and then return it wherever is the most convenient. It doesn't have to be the same Redbox. So Bike Share is the same concept. So we're partnering with the Atlanta Bicycle Coalition and also the Atlanta Bike Share service provider, which is separate from us and separate from the city. It's a private provider, to assess the barriers to community members to actually using the Bike Share once it's launched, as well as promoting increasing awareness of what Bike Share is, how to use it, to the general public at events around Atlanta to hopefully increase its participation. And our third initiative is working with 3 different Fulton County municipalities, East Point, Sandy Springs, and the City of Atlanta, around Complete Streets. So Complete Streets are streets that are designed for really everyone, so all ages, abilities. You can walk, bike, ride transit, or drive. A lot of people have tried to walk somewhere and it's not safe or not even possible. So with our partners there, we're gathering data for those cities, as well as coming up with tools for those cities to assess kind of opportunities to do initiatives around Complete Streets, as well as barriers and some strategies. So things like collecting sidewalk data to help them prioritize where to do improvements.
Well, thank you very much to both of you for joining us today. You certainly point out a couple of critical pieces in that it really takes us all. It may sound cliche, but it takes a village to really address a healthier Fulton County. And you all have been great partners to the Department of Health and Wellness and the Department of Behavioral Health. And we look forward to working with you as we continue on this pitch initiative. We will take a short break, and when we come back, I will have some final thoughts. Stay with us. Today on Healthline, we discuss the Pitch Cooperative Agreement. Pitch stands for Partnerships to Improve Community Health. Funding from this agreement goes towards programs and our partnership with coalitions that promote healthy eating, increase physical activity, and it also goes towards educating the community on tobacco-free living. Already, Fulton County teachers have been learning new techniques to incorporate more physical activity. Additionally, health professionals and neighborhood leaders are being trained to create policies and environments to support the lifestyle changes we are promoting to our neighbors and our families. The county is also educating the community about smoking and exposure to secondhand smoke. I hope you've enjoyed this edition of Healthline. I'm Dr. Patrice Harris. Remember, you can learn all about the services of the Health and Wellness Department and the Behavioral Health Department by calling 404-612-1211. And finally, I would like to take a point of personal privilege. This is my last Healthline episode, and I want to say that it has been an honor and a privilege to serve the citizens of Fulton County. Thank you for watching. My staff will see you next time.